Okay, so this week in class, we're going to really be getting to know the muscles that you need to know. So I'm going to kind of point them out here. If you hear it, I think it's somewhere around like 8 times. That's when it starts to stick in your brain. So if you've only heard it one time, that's not going to be the best case scenario for, say, a test. So I'm going to point them out here, at least the 12 that they're talking about. Just know that the 12 includes quadriceps, hamstrings, and I can't just say like quadriceps, hamstrings. We're going to know the individual muscles. So there are 3 in the hamstrings, 4 in the quads, and there's like a deep muscle in the calf. I feel like you should know. It helps with training. So there are a couple of extras I'm going to throw in. But up here, we've got this one that we talked about, the frontalis. Concern, surprise. That's what we get with this one. So there's the frontalis. Right here in our jaw, we have a very powerful jaw closure muscle. So a chewing muscle, essentially the masseter. And so I always think of it as the mass eater muscle. There's the sternocleidomastoid, the hickey muscle that we talked about in class, that allows you to rotate your head. So when you rotate your head, you can kind of see that one tweak out. You need to know the deltoid, the pectoralis major, the rectus abdominis. That's that superficial straight muscle. Biceps brachii. You need to know the quadriceps group, which includes vastus medialis, vastus intermedius, vastus lateralis, and the rectus femoris. So I always think of it like there are 4 muscles, 3 of them are vastus, 1 rectus. So if you can kind of go quads, vastus rectus. Okay, so, and then we'll get to the back of the body on the next slide. So not too terrible, really. I think I said deltoid, hopefully. Next one is the posterior aspect of the body. So there's that large diamond back muscle. That's the trapezius. There's the broad muscle of the back. That's the latissimus dorsi. You can see the rear portion of the deltoid here. You need to know that. The 3-headed muscle in the back of the arm is the triceps brachii. You need to know that. Gluteus maximus. In the hamstrings, there are 3 muscles that make up the hamstring group. So you're going to need to know semitendinosus, the biceps femoris. So if you remember, like up in the upper body, we had the biceps brachii. That will cause flexion at the elbow. Your biceps femoris will cause flexion at the knee. So we have a couple of biceps. So now you're educated, and someone says like, I'm working my biceps, be like, legs or arms, because now you know. The other one, so it's semitendinosus, semimembranosus, and biceps femoris. Those 3 make up the hamstrings. So with quads, I go vastus rectus. With hamstrings, I go the semis, because there are 2 semis, semimembranosus, semitendinosus, and then the biceps femoris. Okay, so kind of think about that. In the calf, we've talked about the gastrocnemius, which is the superficial calf muscle. There's one that sits deep that I really feel like you should know, called the soleus. When you're training, if you just do like full extension legs, like a seated leg extension or a standing, basically calf raise, you get your gastrocnemius as the prime mover. But if you actually do a seated leg press, you're going to target that deep muscle, which is called the soleus, and then you can make that gastric kind of poke out a little. Kind of interesting thing. These all have, if you study the anatomy of the muscles, they all have implications for how you can train them and make them the best muscle you can make it. Okay, we have to connect to the bones, and we connect to the bones via connective tissue called tendons. So tendons connect muscle to bone, ligaments connect bone to bone. And now we're to diseases and disorders. So these are the ones we'll cover. And whenever we do this, just understand like there are hundreds of disorders with each system. We kind of focus in on ones that the state requires, and sometimes they're putting them in as a way to kind of educate young people in something maybe they're more at risk for. That's kind of what we're thinking. So everyone will likely face some tendinitis in their lifetime. So it's inflammation. Itis is This suffix means inflammation of, and then we're saying the tendon. So they're inflammation of the tendon. They're showing you the biceps brachii here. There is that bicipital groove of the humerus where one of the heads goes, and then the second head's going up to that coracoid process. So in this case, something happened. Maybe they lifted a little heavy, and what happens is you cause, in some cases, a little bit of a tear in it, and it can become aggravated, and then you get inflammation in that area. So this is inflammation of the tendon. So if it was torn in any way, that would be a muscle strain or a tendon strain. And sometimes you get a little tweak in it. It kind of heals itself, but you still have some inflammation. That's considered tendinitis. Or if you just have an inflamed tendon that's maybe not torn, that's tendinitis. And you treat it with RICE, so rest, ice, compression, elevation. Although once you're past like day 2, you really should start to heat it up, exercise it through a range of motion, then RICE it. Okay, strains, we kind of touched on this in the last slide. It's a tearing of a muscle or a tendon. So I always think of the T. T relates to tendon. Strains relate to muscles or tendons. Sprain is a ligament. So ligament is bone-to-bone connective tissue. You only sprain ligaments. You strain muscles. You strain tendons. So it's a tearing of the tendon. And it's basically like, if you think of, pretend like my foot is, or pretend like my hand is a foot. My hand's a foot. And if we roll it, so this is the pinky toe, if we roll it to the outside, that's called inversion. And when you roll it hard enough, you basically have in this area, I'm hoping I've got there's the fibula here. You have like a calcaneal fibular ligament. There's an anterior talofibular ligament and a posterior talofibular ligament. Those are all sprains. This that they're showing you, there's the Achilles tendon. And then in the lateral compartment of your lower leg, you have the peroneus brevis and longus. Those are the peroneal muscles. So the tendon sometimes can get stressed with those kinds of actions. Sometimes you just start cold. Worst injury I've ever seen is when you saw a grade 3 strain on an Achilles. So the dude was playing basketball, pickup basketball on like a Saturday, heard a snap, and his Achilles had rolled up his leg, so his calf muscles, the soleus and the gastric, were kind of in a ball up here, and the tendon was completely separated. So with strains, we have degrees, just like with sprains. If you barely tear it, it's a 1st degree. If you kind of moderately tear, so it's kind of torn halfway through, it's a 2nd degree. And then a 3rd degree is a complete destruction, rupture. It's torn all the way through. So 3rd will require surgery. 2nd degree, if it's bad enough, sometimes will require surgery, but usually that will have enough blood supply to correct itself. And then here's what you'll face in terms of signs and symptoms. I don't know what this word is. Contraction. When the muscle is contracting, so there should not be an O there. Limits function. So we have a limit of function, which means our range of motion is going to be off. Swelling, bruising, takes a couple weeks if it's a micro tear, to maybe 6 weeks if it's a 2nd degree, and maybe longer if we had to end up getting surgery. So it could be pretty rough. Okay, muscle spasms happen a lot in your age group, and the reason why is you're in the throes of puberty, a lot of you, especially the boys. So if you kind of go to sleep and you wake up with muscle contractions that are beyond your control, typically that means that you're dehydrated, and almost every time whatever is wrong with you, I'll be like, how much water have you had? Because really, like, water is somewhere near 70% of our body, and if we're dehydrated at all, it can cause dysfunction in every organ system. So the first question you need to ask yourself is, how much water have I had today? And if you're unsure, if you go to the bathroom and you have really dark urine, that means that you're dehydrated. You should have clear to pale yellow urine, and if you're not getting to that state, that means you're dehydrated. So make sure, one, that you're drinking plenty of water, and then you need to think of things like sodium and potassium. Those are your electrolytes. So for every muscle contraction, we actually have a sodium potassium pump. Those electrolytes kind of switch places because of the way they're charged. And when you don't have the right numbers, then you start to get contractions. So a lot of times it's potassium you're missing. Things like bananas or spinach, you can add to like a fruit smoothie. That can help with muscle spasms as well. So consider your water intake first, and then consider like probably more likely potassium than sodium. What kind of potassium levels do you have? And see how you can up those. And I think I just covered it. Yeah, so you can stretch it. So kind of do a minor stretch if you can warm up the area first so you don't end up aggravating the area. So kind of run your, let's say if it's in your calf, run your foot through kind of a range of motion. Let the blood flow get there a little bit. And then if it continues, that's when I would ice it. But again, a lot of water. Think about your electrolytes. Okay, there's a pretty extreme disorder called muscular dystrophy. It's a genetic disorder, and it just causes the muscles to weaken over time. So the muscle tissue actually degenerates, and they can end up with weaknesses in a bunch of muscles. And there's certain muscles that they kind of anticipate will happen first. So you have the shoulders pulling back here. Belly kind of sticks out due to weak abdominal muscles. The best we can do for muscular dystrophy patients at this time is physical therapy. And the more they work the muscles, the less likely they are to atrophy, but they eventually do anyway. So we can give them some quality of life back by exercising the muscles, by trying to activate those neural connections and things like that. But yeah, this is a rough one because it's genetic and it's going to degenerate regardless. So that's it for muscle notes. Today we're just going to go ahead and fill out the rest of the notes and turn those in. And then I have your second online day planned. When we do that, you're going to be doing some cards, starting to really get into the muscles. So hopefully you're doing well. Let me know if you have questions or concerns, and let's just keep plugging away. Thanks.